In this session, we will be talking about the importance of food consumption data for the decision making. During this session, we will be talking about several topics and we will be tackling mainly the main collection methods that we can use in order to generate the food consumption data that we need for the exposure assessment. First of all, and as we know, there is always this challenge between improving things based on data. And as Kelvin said, if you cannot measure it, you cannot improve it. This is why mainly in our life, we need some, let's say, data, and those data should be accessible in order to improve, to change, or even to understand what's happening. And as you can see in the picture, when we talk about food, food includes not only, let's say, calories, not only nutrients, not only, let's say, macro and micronutrients. It includes contaminants and all other, let's say, types of substance that we would like to know about in order to prevent or mitigate their impact on health. As we already mentioned, and we are repeating this again, the main objective or work scope of the risk managers is really to take the appropriate decision based on the, let's say, possible accurate data that should be robust, basically structured data, evidence-based and documented approach. So when we talk about data, it's not only about the availability of data, but also the quality of the data that we are using in order to make the appropriate decision. And again, we would like to say that we are talking about this, let's say, paradigm of risk analysis mainly, and here we are more focusing on the risk assessment part, basically, in this presentation. So what are the prerequisites that we already also talked about? In the part of data, we need the food consumption data, what we are consuming, and the contaminant or the, let's say, level of all types of substance that are present in the food. So what we are going to do now is to focus more on the first part, the food consumption data, and how can we access it. And then the food consumption data, as we already said also, it's usable. We use it in the exposure assessment as part of the risk assessment work. So let's move now to the main objective. So we have the occurrence of food chemicals in food and the food consumption from the other side. And as Dr. Karima mentioned, it's a clear equation that we use in order to calculate the dietary exposure. We need from one side the concentration of this contaminant times the quantity, the amount of food that we consume, and this will lead to have the dietary exposure. And as we said, this is not a generic number. It's very, let's say, specific for each country and each situation, because the concentration and the food consumption are really tailored to each country or each population. I will skip this since Dr. Karima mentioned the way that we can calculate from the consumed quantity to the occurrence data, finally, to get the final exposure, let's say, assessment for the dietary intake that will be needed for the risk assessment. So we consume several products, and from those products, we can generate finally one, let's say, data regarding our exposure assessment. Yes, we are what we eat. And as we already talked and mentioned, people, they eat the same ingredients, let's say, the same components, the same basic food, but in different ways, in different frequency, and even in different, let's say, occasions. I just had in my mind an example of raw eggs. You know, in Japan, there is what we call tamago kake gohan, which is raw eggs that we use it on the steamed or boiled rice. We have in Lebanon what we call eggs brished, which is really raw egg, just coming fresh from the chicken. And from the other side, you have countries where it's not acceptable to eat raw eggs. So the same product, the way of preparation, the way of consumption, or even the frequency will affect, obviously, the exposure to some contaminant or other, let's say, components. So let's start now talking about the method that we can use in order to assess the dietary intake mainly. And also, as Dr. Karima mentioned, the methods are different from what we call general methods to refined estimate or refined methods. So we have several methods that we are going to mention rapidly that goes from very, let's say, broad way to assess what we consume until really specific and refined methods that are more specific and more detailed. Those methods are mainly based on the quality of food that we consume, and this is basically related to the area, to the population, subpopulation. We even know that in the same country, sometimes we eat the same food in a different way from one region to another. Also, those data are based on what we call the preferred approach. And here we have what we call individual approaches, where we assess the individual consumption of food versus the average household consumption. Those data are based on some stratification, let's say, levels such as age, gender, rural, urban, and other, let's say, stratification components. And obviously, we always seek to use a method that can be standardized regarding the consumption calculation, such as the EU menu method or other that we are going to present now. So the type of food consumption data that we can generate are, as we said, can be very general, related to the population in general, through the household based on family consumption, until the individual based methods. And those methods can generate a lot of data that could be obviously of different types, such as food balance sheet. Those are mainly related to the population-based methods. We have the purchase and expenditures records, as well as on the individual level, we have food records survey, 24-hour recall, and the food frequency questionnaire that we are going to tackle in details later on. So if you look at those methods, as you can see, they use several consumption estimates. Some they calculate mean, median, other they can go to percentiles. And they obviously, the food chain level, as you can see, are mainly related to raw, semi-processed products. And on the individual level, we can achieve more the processed level. And this is why when we talk about to assess the food consumption as it is, it's best to assess it in the form that it will be consumed finally by the consumer, and not in the form that it will be purchased, because the method of preparation, as we already mentioned before, can differ from one group to another. So this is a, let's say, general overview regarding the main methods. As you can see, it's a group of methods that we can use. In general, those mainly are individual. Some are, as we said, household level. Other are national, as we said before. And we presented some descriptions, obviously, for this. Some strengthened and limitation, and where we use it mainly, in which context or which, let's say, reference to be used. I would like just to highlight, for example, the 24 hours recall. It's an individual method. Obviously, the respondent will recall what they consumed in the last 24 hours. Obviously, it will give actual intake because it's not based on memory, let's say. It's not based on past consumption. It's really the actual one. Obviously, it's one of the limitations that it relies on memory, even for the 24-hour recalls, but also it's not really the best representative method for what we eat in general. Some other methods are more, let's say, covering long-term intake, such as the FFQ, the Food Frequency Questionnaire. And obviously, you know that it's more useful and easy to administer because it's based on, let's say, the frequency of consumption. It's more, it's less precise, and it relies more on memory of how much, how often we consume a certain let's say, quantity or type of food. We have other methods that are, let's say, less used, such as duplicate diet method. Here, the participant collects identical portions of all consumed food for laboratory analysis. It's a very specific, very accurate method. It's very good for chemical exposure assessment, this method. But as you can see, it's very costly. It needs a lot of cooperation. People need to prepare the same food in two samples to consume one and to send to the lab the other one. Also, as we said, the food balance sheets are more at a national level, where we calculate per capita the food availability based on national supply data, and we consider that what is available is what we consumed. And it's useful for trends and policy planning, but obviously it will not reflect the actual consumption of individual. It gives us more, let's say, general overview about what's happening. So the food consumption data methods are really diversified. We have some are simple, easy, other are more complicated. It's based on the objective and based on the resources that are available, including time, financial resources, or even human resources, because some methods needs more, let's say, resources in general. If we want to recap, let's say, the common application by use case, as you can see, for the exposure assessment to food contaminants, mainly the preferred method are 24 hours recall, duplicate diets, and the GEMS food data that we are going to tackle more during the breakout sessions. For other purposes, as you can see, nutrition intake, it's more for public health nutrition. We have other, let's say, methods that are preferred, or even for, let's say, for the occurrence data, we can rely on sources that are more or less different from the others. I already mentioned the EU menu method, which is mainly a methodology that is used to assess basically the food consumption using, for example, 2 times 24-hour recall for adolescent and adults. We use other, let's say, method for children. But what is interesting in this method is that data is collected and is based on detailed food and the beverages and supplements that are consumed. We need to describe the recipe, the way that we prepare the food, not only what we eat, but also how we prepare it, the portion consumed, the quantity, the preparation, as we said, method, the place of consumption, time of consumption, and so on. So this method goes beyond what we are really consuming, but it gives us a general idea about all environmental factors that are more or less related to the objective of our study. We know that most regions of the world had, first of all, a lack in data supporting the level and patterns of consumption food products that are critical for exposure assessment are not always, let's say, available. Also, the geography matter is very important. The food availability, the pattern of food production, and patterns of food consumption are changing with significant impact on risk characterization. And here comes mainly all issues related to urbanization, street food, the consumption of a new food, mainly related to some new hazard, let's say, or new trends in the consumption in general. Where we can find those database, as Dr. Amin mentioned, we have a lot of database that we can rely on to assess the food consumption in general. I presented in this slide a series of, let's say, sources that you can use it, obviously, because the material, you will have it later on, as a reference, okay, with the different organization who are issuing those information, the type of data, the coverage, and the main use. So if we say, for example, the GIFT, the Global Individual Food Consumption Tool, okay, so it's a WHO, FAO, let's say, a database that is mainly used for individual level assessment by gender, by age, by food group. And it's used mainly for low and middle income countries. And it assesses the nutrient intakes and the dietary exposure. We have obviously the famous FAO stat, the food balance sheet, that is obviously related to the national food consumption, let's say, food availability, as we said. We have a good, let's say, database for 245 countries or territories, but obviously it gives a macro level food supply and trends. And obviously there is the GEMS, as we said, as a very important reference for food contamination and the consumption data. It's a global one, so it's very important reference, and it's related to the exposure assessment leading to the risk management decisions. So other are represented here, just to say that the major part of those databases are free to access, are available, and can be, let's say, used as a reference whenever you want to answer the question, what are we consuming? Just a short video regarding one of those methodologies. So this is an example, and there is other examples, and we will be using those 2 days to touch more, let's say, database and to work on it. Basically, obviously, we already talked about this part of the principles and methods for the risk assessment, where you can have the dietary exposure assessment for chemicals in food, and there is a part related to food consumption reference. Finally, in my presentation, I would like to present to you a new initiative in the Arab region, introducing the Arab Food Consumption Initiative. This initiative is under the Arab Codex initiative, and with all those, let's say, partners, trying to understand really and to build a database related to the food consumed in the Arab region. It was, let's say, it was an initiative that started in Qatar, in Doha, in 2024, early 2024, where the first meeting for experts for the Arab Food Consumption Data Network were there to discuss how can we combine all efforts in the region in order to understand really let's say, the food consumption in our region. So several objectives of this initiative mainly related to create reliable repository for food consumption data representative of the region. Also, we have as another objective to develop agreed upon methodologies. So because we found that methodology to assess food consumption are not really harmonized between countries. And if we want to combine those data, we need really to be sure that there is no difference in the language or the method that we use to assess the food consumption in the Arab region, to develop and maintain the set of enabling tools, basically to use the IT, let's say, as a facilitator to collect all those data and combine the information from all Arab countries. Also, we have other objectives such as to develop training material and capacity building programs also related to food consumption data collection in the Arab region, as well as to develop and maintain a network of experts. And here we would like to invite you, if you are interested, to join this network of experts that are related to or working on the food consumption data in the Arab region. The initial mapping of the Arab food consumption data is already available. We had several sources from different countries related to the food consumption. Obviously, I will not go through it in details, but we have from Saudi Arabia, we have from Bahrain, Oman. We were able to identify several, let's say, national studies and surveys related to food consumption, as well as from other countries like Qatar or even UAE and Lebanon, obviously with the other, let's say, method that were used, as you see for Kuwait, for Palestine, and for Jordan in general. So those data are already available. We are working on harmonizing as we said, the methodology in order to arrive finally to common ground between all Arab countries related to the food consumption. It needs a lot of collective efforts from the universities, from the research centers, as well as the governmental agencies who are involved in assessing the food consumption in general. Finally, as we said in the beginning, if we want to improve it, we need to measure it. But let's say that we cannot measure it. If we want to improve it, we need to measure it accurately, and this will lead to improve it in an efficient way. So as we said, maybe there is a lot of data, but are we sure regarding the quality of this data that is available? This is a big, let's say, challenge to understand. What is available is if it's accurate or not, it's representative, it can lead to good decisions, because as you know, bad data will lead to bad decisions.